Governor, thank you for joining us on a very important morning for New York City. Before we get to the reopening, give us the latest on the numbers for the state of New York.
A pleasure, Stephanie. Thank you. You know, in New York, we're a slave to the science, right? We've been following the science and the data and the metrics from day one. We have the best numbers that we've had since this started today in New York. We only had 10 deaths. For us, that's the lowest number since this started. It's down from a high of 800. We have about 1,000 people in our hospitals from COVID. That's the lowest number that we've had. And we do more testing than anyone else. The testing is the way you know day to day how you're doing. And it's so important to track this disease day to day. Yesterday, we did about 57,000 tests in one day. That's the highest of any state, even per capita, higher than most countries on the globe. And the testing said that less than 1% were positive, which is the lowest transmission rate in the United States of America. So, so far, so good.
Well, with all due respect, sir, if there's someone I would point to who I would say would be a slave to science, I would say former CDC Director Tom Frieden. He said over the weekend what a disastrous job New York City has done, specifically Mayor de Blasio, in moving contact tracing, giving that mandate to an agency with no expertise whatsoever. We know how important contact tracing is to this next phase. So what's your take on what New York City is doing?
Yeah. New York State, we did it a little differently than most states, right? The state controls the phasing all across the state. In other words, the cities are not in control. The counties are not in control. For the simple logic that this disease does not recognize city boundaries or county boundaries. And rather than having a lot of cities and counties all across the state making decisions, which wouldn't make sense and which would be chaotic, and which we've seen in other states, we said the state would have one set of parameters, one set of metrics, and it would apply it all across the state. And that's what we're doing. So if there's a problem in any locality, the state determines if that locality opens, goes to the next phase, or if that locality closes. Now, you're right that the cities are in charge of compliance with social distancing, et cetera. And I've made it clear to all the local governments that we only got where we got. We've only made the progress we've made because we have been disciplined about it. And the local governments have to do their job. If the local governments don't do their job and the compliance is lax, you'll see it in the numbers from day to day. And we have not yet seen that. If that does happen, then the state would step in and take action, again, because it's all under state control. There is a kerfuffle in New York City where the mayor moved the tracing function from the Department of Health to a hospital subsidiary. That's an internal decision by the city, and you have people like Frieden, I'm sure, who have strong opinions that it should have stayed with the Department of Health. But look, that was a local decision. We'll see how it goes. And from my point of view, it's about, is the infection rate going up or down? And do we have the tracing in place, which we do, and as has been evidenced thus far. So I understand the internal kerfuffle. I stayed out of that. I'm just watching the numbers, and if there's a change in the numbers, then the state will act. It's not even up to the cities.
Well, let's take a look at the numbers in other states. You've said before that you're fearful of people traveling to New York from states that are seeing spikes. Are you considering quarantining visitors from other states? We know Florida did that to New York.
Yeah, look, Stephanie, this nation has to take a step back now, right? We had two theories on reopening. One theory was reopen right away. Government shouldn't keep the economy closed. And this is all politics. So reopen, reopen, reopen. And some states did that. The second theory was, no, we're dealing with a disease. The disease does not know politics. We have to do it as a science because we're dealing with a disease. New York, New Jersey, Connecticut, some other states did it as a science and took a political pounding from the White House that we were slow and we were going to hurt the economy. We tested those two theories. You now have the results on those two theories, Stephanie. Look at the states that reopened quickly, recklessly, in my opinion, without any controls, and you see the virus going up. Florida, Arizona, Texas, 20 states. That's what happens when you reopen politically and you see the virus go up. And by the way, you didn't even do any favors for the economy, because when the financial markets see the virus transmission go up, it gets nervous. The virus goes up, the markets go down. New York, Connecticut, New Jersey, other states that did it on the metrics, you're seeing the infection rate come down. New York now has the lowest infection rate in the United States of America, and that was from the highest, right? So you tested the two theories. And frankly, following the science works. It saved lives, and it's better for the economy because the economic opening is sustainable as opposed to these fits and starts. And they gave us a whole line, well, it's not that the virus is going up, we're doing more testing. That was just not true. You look at Florida, more people are going into hospitals. It has nothing to do with testing. More people are going to ICU beds. It has nothing to do with testing. The virus is up, more people are getting sick. And now our fear in New York is those people are going to travel to New York, and they could bring the virus with them. So we are seriously considering, and I'm talking to my neighboring states, because for one state to act, it's more effective if we act as a regional collaboration. And I'm talking to them about putting in guidelines so we don't have people coming from these other states, because I'm telling you, I get phone calls from people in Florida, et cetera, saying we want to come to New York because we're afraid of the virus.
Well, if the statement was true, all those increased tests would have negative results, and they don't. Governor, House Republicans are looking into New York's March 25th order that directed nursing homes to take in infected patients. This thing is not going away, sir. 6,300 people died in New York nursing homes. That is the most in this country. The more time has passed, the more your office has been able to look into this. Do you take responsibility for that order and the role it may have played in those deaths?
Yeah, the Republicans, Stephanie, are playing politics. They don't want to talk about how they are now handling this COVID virus. Yes, I understand that. And there are facts also, Stephanie. So let's look at the facts, right, rather than the political rhetoric. Yes, we had more people die in nursing homes than anywhere else because we had more people die. Because the federal government missed the boat and never told us that this virus was coming from Europe and not from China. And January, February, March, before they did the European travel ban, 3 million people came from Europe and brought the virus to New York. And the federal government didn't know, and the federal government and the CDC and all of them failed to handle this pandemic and warn this nation. So New York had more cases, more deaths, and more deaths in nursing home because that's who the virus affects. It affects senior citizens. We know that. You look at any state, and they had a tremendous number of deaths in nursing homes. It's all a political charade, and it's an ugly one, frankly, to talk about a number of deaths and suggest there was politics at it. The number of deaths are still going up, Stephanie. Look at Florida, look at Texas, look at Arizona. Let them look in the mirror and say, you know what, we were wrong. We're killing people unnecessarily by this irresponsible, reckless reopening, and it's not working for the economy either. Those are the facts, Stephanie. There are still facts and truth in life, even in this political mayhem that this nation is in.
The crisis that we're facing is impacting almost all aspects of our lives. Something else is happening in New York. Today, we learned that the Museum of Natural History has been given directive permission from New York City to take down a statue of Teddy Roosevelt in front of the museum. What is your take, sir?
Yeah, I think the museum has made a decision. They think the statue in this environment is in bad taste. They want to take it down. I support their decision. I think we have a very special moment in this nation, Stephanie. You're seeing people stand together, and this outrage over Mr. Floyd's murder has been a long time in coming. I say finally. For us now, the trick is going to be as a nation, how do you take this moment and make it a moment of actual change rather than just a moment of expression of outrage. The expression of outrage is great. The community that's come together is great. The expression of love is great. And that's what they're really saying. They're saying love over hate. They're saying unity over division. That's what they're saying, and they're right. But now let's take this moment and actually change policy so we don't go through this again. And let's reform our public safety departments and our police departments all across this nation. We must do it. Policing doesn't even work if you don't have the respect and trust of the community you serve. And we don't right now. So in New York, what we're doing is every local government with a police department has to come up with a reimagination, reinvention plan in collaboration with the community to design a police force that the community wants in 2020. It's about time.
Governor, I know we're out of time, but I've got to ask, because you're talking about outrage and this moment. But you know what else we're seeing in this moment? Last Friday, Jeffrey Berman gets fired. We've got to get your reaction. You were Attorney General of New York. You worked with SDNY for a number of years. What's your reaction to this? Talking politics.
Yeah, you have a president who believes the Department of Justice is a political function. He has made that clear from day one. The concept of, well, the Department of Justice, that's really a separate, independent, and you don't politicize justice. Yeah, this administration doesn't believe that, Stephanie. They've made it clear. It starts with Attorney General Barr. Let's be honest. The picture of him standing out there being the advance man for the president's photo opportunity, where they used the military at the White House to move the protesters so the president could have a good photo. The Attorney General of the United States is not normally a political advance man for the President of the United States. But that's their attitude. They don't like the U.S. Southern District here. They've been investigating the president and his allies. So fire the person who's doing it. I don't think we should be shocked.
Then what happens to all those investigations? Then let's say we're offended. It's ridiculous that they did this. At the end of the day, they got their desired result.
Well, no, because the way the Southern District works is you can replace the head, but unless you fire everyone in the entire office, you'd have to fire 100 people, because those professionals in the office are not going to drop the investigations just because you replace the head. That's not going to happen. And whoever you put in, if he tries to stifle those investigations, good luck.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.